Welcome to The Explainer. So today, we're diving into a pretty startling critique of India's private healthcare system. And what makes this so powerful? Well, it's coming directly from the doctors themselves. This quote, which was actually highlighted by the doctors in our source material, it really sets the stage. It's a chilling reminder of the incredible amount of trust we place in medical professionals and, well, the terrible consequences when that trust gets broken. So where is all this coming from? Well, our source is this incredible book called Dissenting Diagnosis. It's based on some really candid interviews with 78 practicing doctors all across India, and they are really breaking their silence about the state of their own profession. At the very heart of what they're saying is this one core revelation: what used to be a profession focused on service has just completely transformed. It's now a market-driven industry. The old idea of keep the patient foremost has been buried under this new logic of keep profits foremost. And you can imagine the few ethical doctors who are left, they say they feel totally suffocated. Yeah, and this quote from a senior diabetologist, it just perfectly captures the crisis. It's not just some casual observation, it's really a confession from inside the ranks that the very soul of the medical profession, well, it's been compromised. Okay, so that's the big picture, but how does this crisis actually affect patients on the ground? Well, the doctors we're hearing from reveals some absolutely shocking malpractices, things happening every single day, usually behind closed doors. And according to these doctors, the exploitation often starts right at the very first step, the diagnosis. This is that moment, right, when a patient is most vulnerable, and that vulnerability can be leveraged for profit. And some of the schemes they describe are just, wow, they're as clever as they are cruel. They talk about admitting dengue patients who don't actually need it, all for a hefty bill. Or get this, using the wrong medical charts for newborns to scare parents into paying for expensive emergency care. In some cases, pathologists even hand out fake reports to turn a perfectly healthy person into a lifelong diabetic patient, all for the money. But believe it or not, the problem doesn't even stop with tests and diagnoses. It goes way deeper, right into the operating room, where there's this disturbing pattern of totally unnecessary and sometimes completely fake surgeries. This might be one of the most shocking things in the entire book. A general practitioner describes a patient being put under anesthesia, given a few stitches to make it look like something was done, but no actual surgery happens. And then, bam, a huge fraudulent bill is generated. It's just a profound, unbelievable betrayal of trust. So you have to ask, what could possibly drive that kind of behavior? Well, the doctors interviewed all point to one single pervasive thing: this underlying system of commissions and kickbacks that has basically corrupted the entire medical ecosystem. Yep, they have a name for it: cut practice. And it's pretty simple. It's a hidden web of financial incentives. So, every time a patient gets referred for a test or a procedure or to see a specialist, a kickback, a cut, changes hands. And that fundamentally corrupts medical decisions at every single level. And when you look at who gets a piece of the action, the sheer reach of this system is just staggering. It's not just the doctors. We're talking commissions paid to almost everyone down the line: specialists, labs, hospitals, pharmacies, all the way down to ambulance drivers and even the auto rickshaw drivers who bring patients to a specific clinic. And this right here, this is why the whole system is so damaging. As this doctor from Kolkata explains, the entire incentive structure gets turned on its head. For many, the money you make from just referring a patient is way more than the fee you'd get for actually treating them. So patient care, it just becomes secondary to generating those profitable referrals. Now, it's really important to understand that this internal decay, it didn't just happen in a vacuum. It has been massively amplified by outside forces, especially the rise of corporate for-profit healthcare. What these doctors are really describing is this huge fundamental shift. The profession went from being this personal, trust-based relationship to something that's totally impersonal and transactional. They call it a hospital mall industry, where the goal isn't just the patient's well-being anymore, but hitting targets and delivering returns for shareholders. Just imagine being a doctor in this pressure cooker. Hospital management is giving you conversion rate targets, basically quotas for how many consultations you need to turn into surgeries.
One young doctor was flat out told to get his rate up from 15 to 40% or he'd be fired. Then you add in the influence from pharma companies who are essentially purchasing doctors with gifts and fancy trips. You can see how even a well-intentioned person gets forced into these unethical practices just to keep their job.
And, all of this, it brings us to the human cost, not just for the patients, but for the doctors themselves. We're talking about the deep personal struggle of those who are trying to hold on to their principles in a system that basically punishes them for it. Listen to this. This quote from one of the physicians is just devastating. "We will now need a microscope to find any white sheep that remain." It really gives you a sense of their genuine fear that being an ethical doctor is becoming an endangered species. So you see, these doctors who are speaking out, they're not just angry. There's this deep feeling of helplessness. They talk about being bad-mouthed by their own colleagues for refusing to take kickbacks and just fighting this constant, lonely battle against all the commercial pressure. And so all of this leaves us with a really big, kind of haunting question. After hearing directly from doctors who are diagnosing their own profession as critically ill, you're left to wonder, if the doctors see the sickness so clearly, who's responsible for the cure? Where does the healing even begin?